आप देख रहे हैं बीए न्यूज, खबर हमारी फैसला आपका। इस वक्त की बड़ी खबर।
लखनऊ CTDDR का शुभारंभ। पहला दिन संश्लेषणात्मक एवं औषधीय रसायन विज्ञान में नई रणनीतियों पर केंद्रित रहा। वैज्ञानिकों ने अपने नवीन शोध निष्कर्षों को प्रतिभागियों के साथ साझा किया। CSIR केंद्रीय औषधि अनुसंधान संस्थान लखनऊ में आज औषधि खोज अनुसंधान में वर्तमान प्रवृत्तियों पर अंतर्राष्ट्रीय संगोष्ठी के 9वें संस्करण का उद्घाटन किया गया। CSIR CDRI लखनऊ की निदेशक डॉक्टर राधा रंगराजन ने कार्यक्रम के विशिष्ट अतिथि, डीन एवं वरिष्ठ परामर्शदाता, होली फैमिली अस्पताल नई दिल्ली के प्रोफेसर बलराम भार्गव एवं मुख्य अतिथि CSIR की महानिदेशक एवं DSIR की सचिव डॉक्टर एन कलेसेल्वी के साथ उपस्थित सभी गणमान्य व्यक्तियों का स्वागत किया। उन्होंने इस महत्वपूर्ण औषधि खोज सम्मेलन के बारे में जानकारी दी और प्रतिभागियों को ये बताया कि वे इस अवसर का उपयोग कैसे सीखने, नेटवर्किंग करने एवं अपने अनुसंधान कौशल को उन्नत करने के लिए कर सकते हैं। फार्मास्यूटिकल नवाचारों का वैश्विक केंद्र बन चुका है। भारत ने लगातार उच्च गुणवत्ता वाली और किफायती दवाओं के निर्माण की अपनी क्षमता को सिद्ध किया है, जिससे विश्वभर में स्वास्थ्य सुविधाओं की पहुंच सुनिश्चित हो रही है। APIs की उपलब्धता एवं नई दवाओं की खोज जैसी चुनौतियां अब भी महत्वपूर्ण विषय बनी हुई हैं। उन्होंने आगे कहा कि क्वांटम कंप्यूटिंग और आर्टिफिशियल इसके साथ ही उन्होंने आपसी सहयोग को भारत की फार्मास्यूटिकल सफलता का एक महत्वपूर्ण आधार बताया, जिससे ये सुनिश्चित किया जा सके कि नवाचार बड़े पैमाने तक पहुंचे और भारत स्वास्थ्य सेवा में अपनी किफायती नेतृत्व क्षमता बनाए रखे। कार्यक्रम की मुख्य अतिथि CSIR की महानिदेशक एवं DSIR की सचिव डॉक्टर एन कलेसेल्वी ने प्रतिभागियों को संबोधित किया। उन्होंने इस अवसर पर जोर देकर कहा कि कार्यक्रम की इस प्रकार के सम्मेलन शोधकर्ताओं, उद्योगपति एवं युवा वैज्ञानिकों को सहयोग के नए अवसर प्रदान करते हैं, जिससे फार्मास्यूटिकल्स और हेल्थ केयर में नवाचार को बढ़ावा मिलेगा। उन्होंने कहा, विज्ञान की कोई सीमाएं नहीं होती, जिससे ये कार्यक्रम वैश्विक सहयोग का एक द्वार का काम करेगा।
My answer to that is we're going to have to find out. My gut feeling is yes, it's probably going to be problematic in a chronic use situation. My other gut feeling is, and something that very much concerns me, is with the role of cancer that is involved with these targets. If you're treating someone for pain, could you be masking the development of a cancer, or could you be actually sort of facilitating a cancer development? So all because it has so many side effects.
Yes, that is my main question. Because in your case, in study number 1, if the woman is mentally sane, so if she's having only knee pain, in that case, if you are using haloperidol, so for longer periods of time, then it might affect like the mental activity. But in your case study number 2, we are seeing that the person is also facing the suicidal tendency. So in that case, I think haloperidol can be helpful. So what's your take on this?
It could be. In fact, I'm not sure I would choose haloperidol, but there are some other antidepressants that actually interact with the sigma receptor as well. And some of the antidepressants are actually fairly decent at treating neuropathic pain. Amitriptyline, the tricyclic antidepressant, is used for neuropathic pain treatment. Yeah, duloxetine. There's a handful of others that are used that could be beneficial to these patients.
So is there any correlation? Did you find any correlation between the mental health and the knee pain in particular?
We didn't really interrogate the mental health very much, and I will tell you why. This is a very difficult study for these patients because they have to go off of all their medications 72 hours prior to being scanned because there could be interference with their medications. So first and foremost, many of these patients were in withdrawal when they were actually being scanned, and so the mental state was very hard to try and assess.
Haloperidol generally puts the person in a drowsy state as well. So in that case, it might be helpful in elevating the pain. But then it is again a CNS acting drug, so I think it might be affecting the CNS as well activity. So it should not be, or it is like.
Yeah, I think you would really have to think about the high incidence of extrapyramidal side effects associated with haloperidol to really look at a risk versus benefit ratio in the right patient, maybe, yes, but I don't think I would look at it as a general. Pain relief came instantly. This guy was able to get up and start moving around. It doesn't tell us that we actually identified the pain, but it sure looks like we more than likely have identified where the pain is. So his answer was, my knee is back to normal, and it's in fact stronger than my other knee, which is what you would expect after a good ACL repair. Okay, so just to summarize where we are with this, as I wrap up, we've done 190 chronic pain patients. All of these patients have come to us in a similar state at the very end of their approach. They don't have any other options left. 21% of those patients presented with an abnormal is the GMP step. So this also cuts down on cost tremendously, right? For us to be able to get into humans. So I won't talk anymore about chemistry. I'm going to get to some of the good stuff now. So what I mentioned before is we actually were very fortunate to know that sigma-1 knockout mice were viable and that we could use these as a comparator for seeing how selective our compound was. We took our compound and tested it against over 100 known drug targets and didn't find any affinity at any of those targets. In fact, our selectivity ratio was over 1,000. Presents the poster, and just a few people came by, like I told them. But one of those people that came by was a radiologist from Stanford. And that radiologist said, hey, we're very interested in sigma receptors for cancer treatment, and we'd like to see if we can make an imaging agent out of your probe. Can you add a fluorine somewhere to this molecule? And so my graduate student came back so excited and said, we gotta add a fluorine, we gotta add a fluorine. I said, okay, let's figure out where we're gonna add a fluorine. And so we decided to add a fluorine and really took this molecule that was selective, and actually the most selective reported sigma-1 compound at the time. We did this over a battery of many other targets as well that were usually problematic and associated with sigma affinity. But we had greater than 100-fold selectivity over all those targets. Some of the reaction steps, because it was only a few hours of a reaction. And they could come in after morning classes, work in the lab for the afternoon, feel like they're contributing to a project, and then take off back to classes. So it's a big way that I always try to get students into the lab to do something easy, give them exposure to the